Coming up next on the Jeff Crilley Show, we're going to be talking about fibroids. If you're a woman and you have them, then you know what they are. And we'll be talking about why the pandemic may have made them worse. That's next.
Many are predicting that the worst is yet to come, which is unfortunate, said one person here. Until now, they've enjoyed the reputation of being the nation's icebox.
Watched a burglar in his home this morning by webcam.
As a journalist of over 25 years, stories are what make my world turn.
Reporting live from the Dallas newsroom tonight, Jeff Crilley, Fox 4 News.
But in 2008, I took the jump from my familiar life and started a PR firm from my home.
We're talking about anyone with a camcorder like the one I'm using becomes a television network.
We started slowly growing the company, and we now have over 100 clients, and we've branched into the world of live digital broadcasting. I now own 8 different TV studios and have a huge team, and the stories that I now get to share are sometimes the most important of my life. Life has a funny way of coming around full circle. This is the Jeff Crilley Show.
Well, as you know, on this show, we like to get into medical conditions, especially ones that you may not be familiar with. And to educate us today on fibroids, Dr. Suzanne Slonim. She is the founder and medical director of Fibroid Institute Dallas. Thanks for coming on the show.
Thanks for having me, Jeff. I'm happy to be here.
All right, well, let's start with the basic. I think people have heard of fibroids. They may have seen a commercial in their life about fibroids, but they don't know what it is. So what is a fibroid?
Well, let me tell you, fibroids are the most common non-cancerous tumors in the uterus, in a woman's uterus. They're made out of fibrous tissue and muscle cells. They're very common and they can cause lots of symptoms.
And you told me just before the show began that your patients are telling you that their symptoms are worse because of the pandemic?
Yes, you know, there's been a study that has shown that the stress related to the pandemic is causing worsening of fibroid symptoms. It's kind of like post-traumatic stress disorder. It's post-pandemic stress. Women's symptoms are getting worse with their periods.
And what are the symptoms, and would a woman know when if she has them?
So the symptoms are very common. They're heavy menstrual bleeding, cramping pain, pelvic pressure, frequent urination, constipation, bloating, pain during sex. And you get a couple of these together and you speak to your gynecologist, you're going to find that the gynecologist is usually going to find, or often going to find, fibroids.
And if they're not seeing their gynecologist, would a regular doctor pick up on these?
If they do a pelvic exam, they may be able to tell, but really a gynecologist or a primary care doctor who does pelvic exams would be easily able to detect fibroids if they're big enough. The next way to evaluate is with an ultrasound. That's probably the most common way that fibroids are discovered.
And you're very passionate about this. You formed your institute just 5 years ago.
Yes.
And we found a wonderful television commercial. I love the way you like to educate your patients. So let's go ahead and roll that commercial now.
Doctors are definitely some of the busiest people in the world. So you can only imagine how busy the life of a super doctor can be, especially one who's an author and on a mission to make every lady aware that they have options outside of surgery for fibroids. Dr. Suzanne Slonim has numerous awards, accolades, and raving reviews from her patients. She has a thriving medical practice and is constantly being featured on the radio and in the news publications. She hosts her monthly fibroid-free radio segment on KRMB's radio station, and at the end of her long days, usually she spends her evenings at home on the phone personally speaking to patients who have questions or concerns. Dr. Slonim is the example of the kind of person you would want a doctor to be. We wanted to give a special shout out to Dr. Slonim. We will be launching a new mentoring platform. But we couldn't think of a better mentor to launch this exciting new platform and showcase different professions and careers. Thank you, Dr. Slonim, for everything that you do for your community, your friends, and especially for the urban specialists. Please go follow Dr. Slonim at Fibroid Free MD.
I love how active you are in the community. This really is your ministry, isn't it?
It really is. It's a passion. I feel very strongly. I feel that women need to know that there are options out there for them to have treatment other than surgery.
And a lot of women have been told they need a hysterectomy, and that's just not true.
Well, sometimes it's true, but often it's not. Often there are other less extreme, less drastic measures that can be taken to fix the symptoms without having surgery.
And I need to congratulate you because it was almost like Mr. Smith Goes to Washington. You you have a month named after something that you fought for. We're going to put it up on the screen, and I want you to describe what you were able to do.
I would love to. So we've been working, a team of people really has been working for about the last 9 months trying to get legislation passed to recognize July as Uterine Fibroid Awareness Month in Texas. And we were actually able to get it done in the last legislative session. And then we also got the city of Dallas made a resolution saying that it's City of Dallas recognizes Uterine Fibroid Awareness Month, and Dallas County did the same thing. So we have the city of Dallas, the Dallas County, and the state of Texas have recognized Uterine Fibroid Awareness Month. It's very exciting.
It is. That's the trifecta, too. And that was no easy feat. Tell us how much work went into getting that.
There was
passed.
a lot of calling on friends for their, who do you know who has a connection to someone in the legislature, someone in the political realm that's not an area that I'm very familiar with. And I was lucky enough to have people with a lot of connections. We were able to connect with Representative Senfronia Thompson. She's the longest serving woman in the Texas state legislature and the longest serving African American. And this, of course, is something that's pertinent to her because I don't know if we've mentioned it, but 80% of Black women have fibroids, and she's a Black woman. So it's right in her area of interest and passion as well. And she shepherded the legislation through the House of Representatives, and we got it through the Senate as well, and the governor signed it.
Why is it so prevalent in the African American community?
That's a good question. We don't know. There's got to be some genetic component to it. There's lifestyle issues, there's health-related issues, there's racial bias-related issues. Fibroids are like a different disease for Black women. They start earlier, they grow faster, they're more often multiple, their symptoms are worse. Black women are 7 times more likely to have surgery for fibroids and 2.5 times more likely to have a hysterectomy than white women.
Wow. Let's talk about the pandemic. First of all, I guess a lot of women probably didn't get checked during the height of COVID. That creates problems.
Right. So a lot of people did not get their normal routine health screening and health care during the pandemic. We also know that during the pandemic, women who had infection with COVID, it changed their menstrual symptoms. COVID, it's clear that it causes clotting abnormalities, so that affects menstrual bleeding. And women with COVID infection had longer periods during that time.
You also mentioned before the show that stress plays a role.
Yes, the stress of having the pandemic, the stress of being locked down. Women with fibroids reported worse symptoms during the pandemic than they did before the pandemic. So there's clearly, it's well shown that there's a relationship between stress and fibroids. And so that became clear.
And do we know anything about the vaccine yet and how that works in the body?
I'm really glad you asked that because my patients are reporting to me that since they got the vaccine, their bleeding is heavier. I keep hearing that. Every week I'm hearing that. It hasn't been studied yet. I'd love to do a study. I'm going to see if I can put something together. But to the women who've had the vaccine, it seems clear that having the vaccine increases the heaviness of their bleeding.
If a woman is watching this and she thinks she might have it, how if it goes untreated, how devastating is that?
If the fibroids go untreated?
Yes.
In some women, if you find out when you're 45 that you have fibroids, then if they're not causing you much problems, they're probably okay. They stop growing when you go through menopause, which is between 50 and 55. But if you're a 28-year-old woman and you've got fibroids already, multiple fibroids or medium-sized fibroids, they are going to keep growing until you go through menopause. And then in another 10 years, they may be much more difficult to deal with. So definitely check them out, have a gynecologist check them out, make sure you know that there are options for treatment besides surgery, and take care of them before they get too difficult to deal with.
You mentioned diet earlier. Does diet play a role?
Diet definitely plays a role. We know that eating a diet high in red meat increases the risk factor. Eating fruits and vegetables decreases the risk factors. High sugary foods with a high glycemic index, give you an increased likelihood of fibroids.
Okay, let's do kind of a Mythbusters segment. Are there some myths that you've heard in your journey about fibroids?
Yes, I've heard a myth that fibroids can rupture and you can die from that. That does not happen. Fibroids don't rupture, but they definitely can grow big enough to cause you serious health problems.
Okay, we only have about 2 minutes left, and I want to make sure that you get all of your messages out. So what are some things that you would like to leave the audience with?
It's important to know that there is information available, and now that we have Fibroid Awareness Month, hopefully there will be more information available on the internet. Do some research, speak to your doctor. If your doctor's not willing to talk about options other than surgery, find another doctor. There are resources out there. Talk to your friends. It shouldn't be too embarrassing to talk to your friends about fibroids because, listen, 80% of Black women and up to 70% of white women have fibroids. They're very common in Hispanic women as well. A lot of my patients are Asian. All women have this problem. And if you talk to each other, we can spread information and prevent unwanted hysterectomies. That's what I want to do, is I want to prevent unwanted hysterectomies.
Wow, thank you so much. You've been an amazing guest. We're going to end with your website. It's fibroidfree.com. Dr. Suzanne Slonim. Thank you for coming on the show.
Thank you for having me, Jeff.
And that's it for now. We'll see you next time.